Welcome to yet another episode of Apnao Conversations, and we are continuing with our series, A Girl is Precious. Now, cervical cancer is a major public health concern globally, and it is the second most common cancer in women. Every year, more than 270,000 women die from cervical cancer. 85% of these deaths are in low and middle income countries like India. Yet, there is not much awareness about preventing this. Today, my guest is Dr. Chinnababu Sunkavalli. Dr. Chinnababu is a renowned robotic surgical oncologist, cancer surgeon. He has over 20 years of surgical experience. He is a senior consultant and director, Surgical Oncology and Robotic Oncology Department at Yashoda Hospitals, High-Tech City, Hyderabad. He is a co-founder of the award-winning Grace Cancer Foundation, a social enterprise that brings cancer awareness and affordable treatment to the people in need. Thank you, Doctor, for joining us today.
Thank you so much for this opportunity.
What are the types of cancers that develop in adolescence? Because I heard that most often the cancers start between the age group of 15 and 19. So what are the types of cancers that develop in adolescence?
Well, I must appreciate this Apnao campaign for the most important topic that you have really brought up for the public awareness. In general, cancer increases as the age increases. So usually it is not seen in an early age in general. But there are certain types of cancers which are commonly seen in second decade. That's where you're talking about adolescent life. For example, there's some bone tumors, there's some blood cancers. There is, all these things. There is some kind of a risk involved in the second decade, the adolescent age group. So, the bone tumors like osteosarcomas are for that. But again, they're not a very commonly seen disease also. We don't have to live with that kind of an undue fear as well. Because, breast cancer, for example, starts picking up at the age of 35, 40, and slowly it increases. So younger age usually less, but again, today the generation is addicted to so much of, the physical inactivity and unhealthy diet, and you see the screen time and the screen fatigue. All these are very high risk factors for these adolescent girls to kind of, have a, poor health. And we are looking at a tsunami of non-communicable diseases, not just cancer, but cardiac, diabetes, and respiratory, mainly because of our lifestyle. So I think that is one significant, change that we all need, especially right from the, adolescent age group, need to inculcate a good physical activity and good, the diet should be good, because today, if you look at the lifestyle of the adolescent girls, the teenagers today, the party culture, the pub culture that you see, the food is unlimited, the fried, saturated fats, the kind of the consumption of the diet also. If you look at this, the binge, I call this as a binge eating. So this is going to have a long-term effect on multiple diseases. The overall health is going to deteriorate. So I think there is a strong case here, even as this Apnao campaign is going to raise awareness and kind of sensitize the public. I think you are what you eat. I say food is medicine. I used to jokingly tell like this, if you eat food like medicine, you don't have to eat medicine like food.
Oh, wow. A great thought for the day. Really a great thought for the day. Yeah. Doctor, please explain to us what is cervical cancer and what causes it?
Cervical cancer is basically the cancerous process occurring in something called a cervix. Cervix is nothing but the mouth of the uterus. So it is the entry point of the uterus, basically, or the starting point of the uterus. So any cancer occurring in this area is called a cervical cancer. And this is a very, very common cancer, second leading common cancer in India. Most importantly, just 10 years ago, it was the number one cancer in this country. But thanks to improvement in the hygiene, health, and awareness, it has now become number two. The causes of cervical cancer are very, very clear and well known. It is caused by an infection called human papilloma virus infection. HPV infection. There are various types of these viruses, maybe 16, 18, 32, 72, 11. There are quite a number of variants of this virus, but the single most well-known cause is the human papilloma virus infection. And there are some predisposing factors as well for this infection. So people with multiple children, childbirths, people who have immunodeficiency like HIV, or people who are smoking, they are at a high risk for getting this infection. But let me remind to all the viewers here that the HPV infection is not a rare infection. More than 80 to 90% of women would have this virus in their body. So in that sense, a very ubiquitous virus, quite commonly seen. Mainly, the risk increases only once a person becomes sexually active. So that's when the infection occurs, and people with multiple partners have a higher risk of this infection. So in general, yes, one word I have to talk about this is a preventable cancer is not prevented.
What do you mean by that? That's quite a powerful statement. And I was like, what? What are you saying? Would you please explain about it?
Yes, well, basically, this is one cancer for which a specific vaccine is available. We know the cause, and we know the treatment also for it to prevent. So to prevent this infection, we have a very, very effective vaccine available. But yet, this has not gone to the minds of the people. The public acceptance is low, and in general, the kind of the response of the public for this kind of an approach is very, very kind of a slow. So in that sense, a preventable cancer is not prevented mainly because of lack of awareness, and it's also because of the lack of access to the vaccine.
What kind of vaccine is available, and at what age should this vaccine be given to? Is it for girls, for women? Can you please explain it to our audience?
Sure. So the vaccines are available, multiple types are available. There are quadrivalent vaccines for 4 viruses. There's a vaccine for 9 types, and there's also single vaccine available. So quite a 3 or 4 variants are available today. What is important is that you need to look at the high risk type of viruses to be covered. So as I mentioned before, 16, 18, and the 70, 33 and 72 types. So if that can be covered with these vaccines, I think that's going to give a lot of protection. So the vaccination when to take the vaccine? Usually the vaccine is taken before the exposure. When I say before the exposure, it should be for the adolescent girls or the teenage girls. From 9 to 12 is the right age, and in the Indian context, we can do it even before marriage. So even before they are actually sexually active, where the infection risk is high. So before that, somebody should take a vaccine. Today, we have a single shot vaccine available. We also have the 3 dose, 0, 1, and 6 months. So that is also available. So depending upon which company vaccine you take, the schedule differs, but there is a definitive vaccine available.
I know that vaccine is expensive, especially the HPV vaccine. How much does it cost? What is how can a common person afford this? Are there any benefits that are available?
Yes, I think the cost of the vaccine per single dose is about 2,000 rupees. So, given the benefit that we have, I think it is not that expensive. But again, some of the makers of the COVID vaccine are offering this vaccine at just 200 rupees in the days to come. And in fact, the government of India is also planning to do a nationwide universal immunization program for this indication.
That was such a good news to hear. I mean, it's such a important thing, and I'm so glad that these kind of facilities and treatment and preventive methods are becoming more and more accessible to people. So what kind of diagnoses are there, or what kind of tests need to be done, and how regularly should people do these kind of tests?
To kind of address this question, what is important is the diagnosis is done once somebody has the symptoms. The signs of cervical cancer, or the symptoms rather for that matter, are basically unexplained or unusual discharge, which is excessive. So more white discharge or more bleeding happening than the regular one, and especially Postcoital bleeding is one sign, and a foul-smelling discharge is another symptom. And apart from this, some symptoms like vague backache and vague abdominal fullness, tightness. All these could be the other symptoms, but the most compelling presentation is usually with bleeding per vagina or excessive white discharge and postcoital bleeding. This is the most common way of presentation. So one good aspect of cervical cancer is it does give you a lead time in terms of from its beginning to becoming an invasive or a full-blown cancer. There is something called as a pre-cancer. So if we can detect the disease in the pre-cancer stage, we can completely reverse the process. So in that way, there is a window of opportunity of close to 5 years, sometimes even 10 years before you have a full-blown cancer. So in that sense, a periodic screening at the right time would definitely go a long way in preventing this disease. So we do a clinical examination and then take a biopsy from the cervix. So a small tissue or a chunk is taken and that is sent for testing. And then once the report comes, the diagnosis is established. Whereas there is another group wherein we talk about screening. So screening is basically done when no one has any symptoms. So when so-called normal people undergo some tests based on their age and the risk factors, and we are trying to identify the pre-cancer also in screening. So this is basically done in terms of there are three methods. One is a simple pap smear, wherein few cells from the cervix are scraped with a brush and they are seen under the microscope if the cancer is big or not. There is another test where we also do the testing for the HPV DNA testing, where if the viral infection is present or not. And then there's a test wherein you do both of them. So the simplest method, all this can be done based on the age and the risk factors. For those between 20 to 30 years, doing this test once every 3 years is good enough. So from 30 to 40, we could do once every 5 years, especially if you are doing a DNA test. Once every 5 years is good enough. And after 40, yearly once is the recommendation. Should there be any pre-cancer stage, then there is an opportunity for us to intervene early and completely cure the disease. So as you may be knowing, the outcomes of any cancer care depends upon the stage of the diagnosis of the disease. Earlier the stage, best or the better the outcomes.
Now, is there a stigma around this? Do women come out openly to get diagnosed and treated?
Parla, I think this is again an important question that we all face today. Women are very shy of even getting screening done. For them, say health this is not a priority in that sense. For them, the caretaking of the family, breadwinning is much more important. And when they don't have any symptom, why will they get a test done? In fact, these are the people when they have symptoms also, they don't seek attention unless it becomes too troublesome and it is beyond their tolerance or the perseverance. So in that context, yes, I do see in my practice as well that there is some reluctance in some communities to even undergo this test for lack of privacy issues, or it could be something in terms of.
Yeah, I've been in some communities like that, and where when I ask the the elders in the family, your wife or your daughter is sick, why don't you take her to the hospital? And they're like, who's going to do the housework? I'm like, well, if she's healthy, she can help more. But it seems to be that women health is not a priority for a woman or even for the rest of the family. And I see that you are especially Grace Foundation is working hard in bringing this kind of awareness and also helping in the prevention of it. So could you please tell us more about how you're engaging in bringing this kind of awareness in the rural settings and even in the urban settings?
Yes, indeed. For the last 1 decade, we have been going to the rural communities, the unreached areas, not only to raise the awareness, but we also tend to engage these women for screening. So we do the mobile cancer screening campaign. So that is basically you take a full-fledged vehicle which has got a mammography for breast cancer, which has got a pap smear facility, which has got an X-ray facility, and the medical team actually goes to their doorstep because they don't seek attention and they don't come to us anyways. So then we thought that why don't we flip the model and we go to them. So that's how this has been happening for the last decade or so, and quite a kind of a fulfillment in terms of the awareness and also the early detection that we've been able to do. And in some of these rural areas, we've also done not just kind of the diagnosis of the pre-cancer, but we also provided the treatment also to them.
Oh, what a blessing this is, especially when people can't reach to a nearest hospital, or if they're living in a place where there's no proper facilities, and of course the rates as well. It's so expensive for any kind of treatment, and what you're doing is really commendable. Such a blessing to the men and the women in these areas. Well, talking about health and fitness, you do this global run every year, and I was so happy to do this last year with my family. So please tell us more about these runs you organize, and you also won so many awards, even Guinness Book of Records for this, isn't it?
See, the Grace Cancer Run is a global event. It is not just a run, but it's an awareness drive globally. We are looking at a participation from across 130 countries this year. This year is going to be the fifth edition. So last 4 years we've been successfully conducting, and this year this run is going to be held across multiple locations simultaneously in the same day or a few days in the same month, because October is considered to be the breast cancer awareness month globally, and that's how we choose the second Sunday of October for this awareness drive. So it's not just doing a run on that day, but we also conduct the awareness sessions every weekend and try to engage the audience to sensitize them about the importance. We also kind of sensitize the children about the causes of cancer, and engage them with so many competitions. For example, people can participate in the quiz competition for causes of cancer. They do the painting, they do the slogan writing. So it's a more of a meaningful engagement of the multiple stakeholders, right? From teenagers, adolescent girls to above sixth grade, all of them will be involved, and so across all segments of society, we try to engage them and drive this, the awareness message. And the run is going to be held in Hyderabad at a place called Gachibowli Stadium. This is going to be in the 5K, 10K, and a half marathon. So people can participate in person, because COVID has really caused a lot of taken away a lot of sweet memories that we could have had. In spite of that, we could still do it. But last 2 years, we have been able to even do this run virtually and in person. And in fact, for the awareness drive, the largest cancer awareness drive for number of people running and posting their videos on Facebook, number of people viewing the awareness session on YouTube. So all of this has become the Guinness World Record. So I think more than the record, what we look at is actually, every single life that we touch, and, kind of make some change in their lifestyle, because physical activity is important to prevent many diseases, including cancer. So the message is very simple. Physical activity, you don't have to spend money. You don't have to really, do anything more. It all requires is a small resolve within you, that, you just want to kind of take care of yourself, and, by spending about 30 minutes a day, or say, for example, we spend about 150 minutes a week for physical activity. I think that goes a long way in giving you good health. So that message of engaging the people to be physically active is what is the motive behind this Grace Cancer Run that is done globally.
Thank you so much for the information. My family and I, and also our Apnao team, we are looking forward to be part of it this year as well. And this kind of awareness is really important for all of us, because we tend to get involved with our work and our social engagements, and we forget to take care of ourselves. And it's good to constantly remind that health is wealth, and if you are healthy, we can do more. And I don't think our time is up yet. There's so much more for us to do in this world. So thank you so much, and I do wish you all the best for the run this year. And thank you for all the information that you shared about cancer as well. And through Apnao, we are hoping that our viewers will connect more and check out your website and the information that you have to share, and also gain knowledge and spread awareness so that we would all be healthy. So thank you so much.
Thank you, Pal. Thank you so much.
Friends, knowledge is power, and acting on that knowledge brings positive results. Our aim through Apnao Conversations is that we bring you that knowledge that will help you. Today, we heard about cervical cancer and how we can prevent it. I strongly advise you to get vaccinated and get your girls vaccinated. I truly want to see girls and women flourishing, and let's do all we can to help each other, to bring awareness, to bring help, to overcome our shortcomings and truly live a victorious life. Every life is precious. Every girl is precious. Take your life seriously. If you're sick, get treatment. If you're young, get vaccinated and protect yourself. Change your lifestyle if needed. Run away from things that will cause harm to your body. Girls, women, your life is important. You were created for a purpose. Protect it, nourish it, and be healthy. I encourage you to take part in the global run Dr. Chinnababu was talking about. You can take part here in Hyderabad and other locations all over the world, and you can do it virtually too. So log in to the website shown below to get more information. Well, that's for today. Please do subscribe to our social media handles and comment and share our videos. Until next time, stay healthy and apnao nayi soch, naya jeevan.
Apnao, apnao.